Good evening, guys. I have an extra one for you. It's D. Discussion D deals with Australia's understanding older care levers, perceptions, and experiences of aged care services. Okay, so here we go. This research topic explores a profoundly under-recognized interaction. How older adults who grew up in out of home care, often in institutional or foster settings, navigate age navigate the aged care system later in life. It's not just about service access, it's about how early life trauma, systematic neglect, and institutional betrayal shape the emotional, psychological, and practical realities of aging for this population. Who are older care leavers? These are adults, often now in their 60s, 70s, 80s, who spent part or all of their childhood in state care, including orphans, foster homes, group homes, or other institutional settings. In Australia, this group includes the forgotten Australians, stolen generations, and former child immigrants, many of whom experienced abuse, neglect, and disconnection from family and culture. Their life trajectories have often been marked by disrupted education, unstable housing, poor health outcomes, and limited social support networks, factors that compound vulnerability in old age. Why this research matters. The central inequity. How do older care how do older care leavers perceive and experience aged care services? Is not just academic. It's a call to reimagine aged care through trauma informed, justice oriented lens. Many care leavers carry deep mistrust of institutions, shaped by childhood experiences of surveillance, punishment, and invisibility. For them, entering aged care can feel like a return to the very systems that once harmed them. Some fear losing autonomy or being silenced again. Others worry about being re-traumatized by institutional routines, uh, unforms or power dynamics. Many express a desire for aged care that affirms their identity, history, and need for control over their environment. Key themes from the literature. The surrounding page synthesizes findings from quantitative studies, survivor testimonies, and policy reviews. Major themes include trauma echoes, institutional aged care settings can trigger memories of childhood abuse or neglect, especially when environments are rigid, depersonalized, or lack emotional safety. Voice and agency. Caregivers often feel excluded from decision making in aged care planning. Their histories are rarely acknowledged, and other preferences may be overlooked. Fragmented support. Many lack family advocates or clear documentation of their care histories, making navigation of aged care systems more complex. Cultural and historical contexts. For Aboriginal and Torres Strait Islanders caregivers, the legacy of forced removals and cultural connection adds another layer of trauma and mistrust. Implications for practice and policy. To create aged care systems that are not only functional but healing, the research recommends trauma informed care. Services must be recognized the long term impacts of childhood trauma and adapt environments, routines, and staff training accordingly. Co-design with care leavers, involving care leavers in shaping policy policies, programs, and service delivery ensures their lived experiences drives reform. Alternatives to institutional care. Community-based home-like models may offer safer, more empowering environments for those with institutional trauma. Staff education. Training must go beyond clinical care to include historical awareness, cultural safety, and relational approaches to trust building. Broader significance. This work, led by the National Center for Healthy Aging and Monash University, contributes to a growing international conversation about equity in aging. It challenges aged care systems to reckon with their own histories and to center the voices of those most impacted by institutional harm. The findings have been cited in policy submissions, media coverage, and advocacy campaigns, pushing for aged care reform that is not only person-centered, but justice-informed. It also aligns with global movements for repetitive care approaches that acknowledge past injustice and actively work to prevent their repetition later in life. In essence, this research reframes aged care not just as a service, but as a site of potential healing or harm for those who have already endured a lifetime of systematic neglect. It asks how can we ensure that the final chapters of life for care leavers are marked not by re-traumatization, but by dignity, safety, and belonging. Okay, guys. I will see everybody tomorrow for shows. Till then, Gator Wellness, take care, folks.